Good morning, Tim Radford here on WKRK 105.5 FM, 1320 AM, cable TV channel 25 worldwide. We're at WKRK.love. And today we have a special guest. We welcome Dr. Eric Clarke from Erlanger, Western Carolina Hospital here on the program. And he is with Erlanger Orthopaedics and Sports Medicine. So good morning, Dr. Clarke. How are you today?
Good morning, Tim. Appreciate the opportunity to talk with you.
Oh, well, we want to welcome you to the area. First off, where are you coming from?
Actually, I'm coming from Chattanooga.
Oh, so not too far away then.
No.
All right. So, well, tell us about have you moved to Cherokee County or are you commuting?
Yes, in the process of moving. So we're living in the Presswood area. I think it's called the community. Right around where the hospital is, close by.
Very good. So what brought you to Cherokee County? I'm guessing the move with Erlanger?
Yes, that's correct. Erlanger contacted me last year about this opportunity and looked into it and started to have more and more of an interest in being a part of the process here, getting the hospital and the orthopedic community going forward and continuing in a good direction. So,
well, very good. Well, the Erlanger Orthopaedics and Sports Medicine is located in the medical office building that is on the Erlanger Western Carolina Hospital campus. Well, tell me a little bit about your background in the field.
Well, I, of course, did an orthopedic residency and then did a couple of different fellowships after the residency. Did some time in Europe and then came back and did a sports medicine fellowship. So I've pretty much done a general practice throughout my career with kind of a focus on sports medicine, which are the more enjoyable things for me. If I had to pick things I like to do most, it would be more in the sports medicine world. But I do the complete orthopedic care of joint replacements and fracture care. So it's.
Well, tell us a little bit more about your passion of orthopedics and sports medicine. What was it about the field that made you want to lean in this direction?
It was most likely when I was growing up, the different sports that I played. So I was involved in multiple sports as I went along, starting off with football and baseball, as most of the American children do. And also did some swimming, and then later on got involved in running and ran cross country and track in both high school and college, and competed afterwards as well. Then started doing some cycling and combined those three with triathlons. So I've gotten away from that more so now and just focus more on some cycling and some jogging. I don't call myself a runner anymore. I call myself a jogger.
All right. Well, tell me about your philosophy on how you connect with your patients. So if I'm coming into your office for the very first time, what should I expect for that appointment to look like?
Yeah, that's one of the reasons I actually have come to Murphy. I think it's probably more opportunity to have a one-on-one relationship with your patients than being in a bigger city. And it's also not so much hurrying patients through. So I enjoy talking with the patient, getting information from them, letting them tell me where they're coming from. And then together we kind of figure out what's going on and how we can not only diagnose the problem, but then go forward with treatment and hopefully have a good outcome. So that whole process takes time, and I enjoy taking time with the patients and talking with them and explaining things that are going on and what the options might be going forward.
All right. So I'm guessing a lot of the things that you see are joint pain and injuries from maybe running or athletics, things like that. So what are some of the most common types of visits that you see in your office?
Yeah, probably the most common one of all is knee pain. You can have that from pediatric to the geriatric patient. And then following that's probably ankle injuries. And then after that would be shoulder injuries. So those are usually the top three.
Well, now that we've covered that, what are some of the things that people need to do to maybe say prevent those kind of injuries? What kind of extra precautions should we be taking?
Well, one of the primary ways to stay out of trouble is to make sure you're able to do the sport you're trying to do by getting ready physically for that. Weekend warriors tend to have more of a problem than somebody who's doing regular exercise. Of course, as we age, the exercise on a regular basis can also be somewhat detrimental to our joints. So then you start having to learn more about how to keep your joints healthy. And that can be done through not only exercises, but also medication or nutrition, I should say, nutritional supplements and so forth. And also the way you exercise is important. So I do spend time discussing, particularly with the runners, since that's been my passion through my life, some tips and so forth to keep you running without getting injured and staying injured. So it's a passion of mine to do that. And also the other sports that tips that I can give about how to stay out of trouble and how to stay out of injury trouble is something that's certainly discussed in the office frequently with patients.
Well, I do know that you're talking about nutrition. I notice whenever I forget to drink my recommended daily allotment of water, I can really tell a difference if 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 I don't drink the water. Have you found that to be something that water is very important as far as keeping those joints nice and moisturized?
Yes. Yeah, water is very important not only for your joints, but for overall function, particularly your kidneys and so forth. And the muscles are important. The tendons all require water. So our body is mostly water. And that certainly something you want to keep supply of, particularly in this area where people go hiking, um, trail running, cycling, off-road, mountain, and gravel riding. Those things are all important to stay hydrated.
All right. So how many years did you say that you've been practicing now?
About 20 years.
So I'm guessing that you've probably seen a lot of changes in technology over the past 20 years on, say, how you were doing your job on day one versus now. What are some of the advances in technologies, or maybe even some new trends in orthopedic care?
Yeah, one of the newer things is, of course, the stem cell injections, which is a bit experimental yet. It's not mainstream or widespread. We don't know exactly the formulation we need to give for certain issues, whether it's a knee, ankle, hip, low back area. But the stem cell research is something that's more cutting edge that we're just now starting to learn more and more about. And that's been something that's been new since I've started. The other part of that is the joint replacement. So the engineering of joints has improved quite a bit as well from the time I started till now. And that's been something that's been exciting to watch. So I think we have better joint replacements to offer people now. And along with that comes the rehabilitation. So I think the rehabilitation therapy information has really improved, and we've gotten more information, and we've gotten better about the way we deliver therapy and how to get patients from preoperative to postoperative functioning. And so there's been quite a bit of change in just about every part of medicine that you can look at.
All right. Well, my notes here say that you are an active outdoorsman. We've touched on that just a little bit. Have you had a chance to explore all the outdoors we have? We have two rivers running through Murphy. We have all the beautiful forest land and so much activity to do. What's been your favorite thing to do so far since you've been moved to Cherokee County?
Well, the only thing I've really done since I've been here, I've only been here a few days as far as being in the area regularly, is cycling. So we took a trip, a 30-mile cycle trip, and went up one of the mountains and then took a big circle around by the river. So we got a little information about the topography of the land, but I expect a lot more will be known as I go forward if I have the time to do that, which hopefully I will. So that's what I'm probably most looking forward to. And I've got various friends that have said, "Oh, you're in Murphy, it's beautiful. We're going to come up and visit, and we'll bring our kayak and so forth." So I see it's something they're going to be looking forward to. So have guests come and enjoy the area as well.
Well, I'm seeing more and more people moving to Murphy because of the beautiful area and all the mountains that we have here, and especially from the larger cities like yourself, because you do want to. There's my phone. I forgot to silence it before we went on the air. But a lot of people are just wanting to move here, and since the pandemic started, we have a lot of people now working from home here because their quality of life is so much better than the rat race of the big city. So we hope you really enjoy your time here in Cherokee County, and I know your patients are really going to enjoy spending some time getting to know you and getting taken care of in your office. So how do they go about scheduling an appointment in your office?
Yeah, so you can call the office to schedule an appointment, and the number is 828-837-9181. And we're located at 75 Medical Park Lane, Suite B, right across from the hospital, separated by a parking lot. So the best way is to call the office and arrange that appointment to be made with, either myself or Dr. Purvis or Jesse Mayo, who's our PA. And so three of us are seeing patients in the office at this point.
Do folks need a referral from their doctor, or call straight and get an appointment without a referral?
Yeah, probably the best way is to call straight, and then the office folks can tell them if they need to have a referral or not. Some of the insurance plans require a referral, some don't.
Okay.
But I think that's probably the easiest way is office personnel can sort that out for you.
Fantastic. Was there anything that you want to say before we conclude our interview?
Yeah, I'm glad to be part of the Erlanger system here and the hospital, and look forward to, like you said, exploring more of the area at some point, as well, meeting new patients and helping them to overcome the problem they're having and hopefully have a good outcome and return to better functioning than they were beforehand. And so we look forward to seeing the patients, and not only in the hospital, also in the community.
All right. Well, Dr. Eric Clarke, thank you so much for taking the time to introduce yourself here on WKRK. We look forward to meeting you in person one day, and we just wish you the best success here in Cherokee County, and welcome to our area.
I appreciate that. Thank you very much, Tim. I appreciate the opportunity to talk with you.
Thank you, and have a great day.
You too.